Hello, everybody. Dr. Clifton Otto here, wishing you a very happy Medical Cannabis Day 2024. Today is a very important day because it marks the 24th anniversary of the day that Governor Cayetano signed our Medical Use of Cannabis Act into law, thereby exercising the state's constitutional authority over the practice of medicine within the state. The theme of this year's logo is Respect the Medicine, which I believe includes two important steps. The first step is recognizing that there is no such thing as recreational use. I believe that people who say that they're using cannabis recreationally are really self-treating for things like anxiety, depression, and insomnia. And I would also argue that there is medical utility in euphoria. So basically, I'm saying there is medical use and there's abuse. And I would include religious and spiritual use within the medical use category. If we can agree that there is really only medical use, then the next step follows very naturally, which is to protect the rights of our medical cannabis patients, which can be accomplished through various things such as education and advocacy. There are some local groups that are doing a great job with the education piece. I would just warn that we should not use education on the endocannabinoid system as a way to promote recreational legalization. This education needs to focus on the needs of our patients. And we're in desperate need of advocacy right now, especially with the situation where over 2,600 of our medical cannabis patients are at risk of losing their primary caregiver at the end of this year, which means losing access to their medical cannabis. Another way to protect patient rights is to understand the law, which means reading the law, not going off of what you hear in the news or what you hear from other people. And I can tell you that understanding the law gets easier the more you read it. Understanding the law also makes it easier to follow the law, which is very important for patients right now. Thinking that certain laws are unjust and not worth following takes us down a very dangerous path of completely disregarding the rule of law altogether and encouraging more criminal activity. Understanding the law also opens the door to changing the law. And perhaps one thing that could be added is a medical cannabis patient bill of rights to specifically protect certain rights, such as uninterrupted access to medical cannabis, personal cultivation in ways that actually address the needs of patients, freedom from discrimination at both the state and federal level, and medical decision-making within the doctor-patient relationship that respects the needs of the patient and the authority of the certifying provider to decide what constitutes a qualifying condition. For those who are more fiscally minded, I'd like to point out data from the CDC, which shows that about 20% of adults in the US are currently suffering from chronic pain. If we extrapolate to Hawaii's population, that means there are over 220,000 potential medical cannabis patients for pain alone. If half of those patients registered with the program, I think a lot of people would be very happy. But the answer for medical cannabis is not recreational legalization. The answer is respecting the medicine, which means making sure that our patients will not be discriminated against at the state or federal level for participating in our program. I think right now it's very important for all of those involved to come together and reach a consensus on these important issues so that there can be a unified force moving forward. And with that, I would like to wish you a very safe and productive Medical Cannabis Day. Aloha.